A nasogastric tube is a small tube that is put in your child's nose and moved down to the stomach. It is also called an NG tube. The tube is a way to give fluids like formula, breast milk, and medicine directly into your child's stomach. This video will show you how to put in an NG tube, how to give feedings and medicine through the tube, and what to do if there are problems with the tube. Practice these skills with your child's nurse before you go home. This will help you feel comfortable putting in an NG tube at home. Your home care company will bring all the supplies you need to care for your child's NG tube at home. Before you start, gather your supplies: the correct size NG tube, a small syringe for checking placement, lubricating jelly, a permanent marker, padding to put under the tube, tape or dressing to hold the tube on your child's cheek, a pacifier for infants, ice chips or a glass of water with a straw is sometimes helpful for older children, a blanket, towel, or firm pillow to prop up an infant or toddler, and a bowl in case your child vomits. The first thing you will do is measure and mark the NG tube so it will reach the stomach. Hold the tube at the tip of the nose and measure the distance from the tip of the nose to the earlobe. Then measure from the earlobe to the halfway point between the lower tip of the breastbone and the belly button. Mark this spot on the tube with a permanent marker. You will need to insert the tube to this mark. If needed, ask someone to help you hold your child or swaddle your baby, toddler, or small child while you are putting in the NG tube. Prop their chest up with a blanket, towel, or firm pillow. Have older children lie back on the arm of a sofa or sit in a chair. Wash or sanitize your hands. Look inside each of your child's nostrils to see which one is clear. Place lubricant on the tip of the NG tube. Gently insert the tube into the nose, aiming towards the opposite eye. Continue to gently push the tube in until the mark you put on the tube is at the nose. Your child will cough and gag as the tube reaches the back of his throat. Give your baby a pacifier to suck on. You can ask an older child to swallow. If your child is sitting up, offer ice chips or sips of water from a straw. Sucking and swallowing will help the tube go down as you continue to gently push it in. If your child continues to cough or choke, pull the tube out a little and then try again. The tube may have curled in the back of the throat. If your child keeps coughing, gasping for air, or turns blue, take the tube out right away. The tube may have gone into his lungs instead of his stomach. Once the tube is in place, put a pad underneath the tube and gently tape the NG tube to your child's cheek. Talk with your child's nurse about the best way to do this. After you tape the NG tube to your child's cheek, check to make sure it's in the right place. Attach a small syringe to the end of the NG tube. Gently pull back on the plunger to check the fluid. The fluid should be clear, off-white, grassy green, tan, or brownish in color. If your child recently ate, you may see formula or some other food particles. Gently push the fluid back into his stomach. If you can't get the stomach fluid to come into the syringe, change your child's position. Then push a little air into the tube with a syringe. Try again to pull the stomach fluids out of the tube with a syringe. If it still doesn't work, but your child is not choking, gagging, or turning blue, the NG tube is probably in the right position. If you're not sure that the tube is in the stomach, take it out and put it in again. Don't put fluids through the tube until you are sure it is in his stomach. If the tube is in his lungs and you give fluid through the tube, you could seriously harm your child. When you are sure the tube is in the right place, measure the length of the tube. Check the length from where it comes out of the nose to the end of the tube. Write this number down in a notebook so that everyone knows how much of the tube should be showing. If the length changes, you will need to check for stomach contents again. A bolus feeding is a feeding given over a short period of time. Try to hold your baby in your arms during a bolus feeding. If you can't, place him on his right side with his upper body lifted up a little bit. If your child is older, he can sit up during the feeding. Never leave your child alone while giving a bolus feeding. Before you start, gather your supplies. Formula or breast milk that is at room temperature, a small empty syringe to check the placement of the tube, a small syringe filled with warm tap water, and a 60 milliliter syringe. Then, wash or sanitize your hands. Give your baby a pacifier if he uses one. Before you give fluids or a feeding, make sure the tube is in the correct place. Do this by measuring the tube or checking for stomach contents. Kink the tube and remove the plug on the end of the tube. It's a good idea to kink the NG tube every time you remove the plug or syringe from the end. This keeps fluids from coming back out. Gently push 3 to 5 milliliters of water into the NG tube. This is called flushing the tube. Take the plunger out of the 60 milliliter syringe. Attach an empty syringe to the NG tube. Pour some formula into the syringe. Hold the syringe high enough to start the flow of the formula. If the formula doesn't start to flow, put the plunger back into the syringe and push gently to get the flow started, then remove the plunger. The height of the syringe controls how quickly the formula is given. Continue to add formula until your child has gotten his full feeding. Hold the syringe so the feeding goes in at a speed that is comfortable for your child. Your child's nurse can help you figure this out. Don't let the syringe get empty. This allows air to get in the stomach and can cause discomfort. When the formula is finished, kink the tube to stop the flow. Take off the feeding syringe. Flush the NG tube with 3 to 5 milliliters of warm water. Then kink the tube again and replace the plug on the end. If your child is an infant, burp him after the feeding is done. A small amount of spitting up is normal. Place your child on his right side after the feeding or hold him upright for a while. If your child needs a feeding pump for the bolus feeding, your home care company will help you set this up. If your child's feedings are to be given continuously on a pump, your home care company will show you how to set up and use the pump. You will still need to check placement of the NG tube before you start a feeding, and once a day while on continuous feedings. Make sure you flush the NG tube with 3 to 5 milliliters of warm water every 4 hours during the day. This will help keep the tube from clogging. Your child's medicine can be given through the NG tube. When you get a prescription for medicine, request the liquid form of the medicine. Some liquid medicine may need to be thinned with water. If the medicine does not come in a liquid, ask for a pill without any coating. Pills that don't have a coating can be crushed into a fine powder and dissolved in water. Be sure to ask your pharmacist if the medicine can be crushed. Important: do not mix your child's medicine with his formula. If your child is getting more than one medicine at a time, do not mix the medicines together. Give each medicine one at a time. Ask your doctor or pharmacist if any of your child's medicines cannot be given through the tube. Before you start, gather your supplies: an empty medicine syringe and a small syringe with warm water. Now, wash or sanitize your hands. If your child is on continuous feedings, place the pump on hold. You do not need to check the placement. If your child is on bolus feedings, check placement of the NG tube before giving medicine. Gently push in the medicine with the syringe. Flush the tube with 1 to 3 milliliters of warm water. Continue these steps until all medicines are given. Replace the plug on the feeding tube or restart the continuous feeding. If the NG tube comes out, you can put the same tube back in if the end of the tube is still soft and flexible. If it's hard, put in a new NG tube. NG tube should be replaced with a new tube at least once a month. If you are unable to flush the tube, it may be clogged. Replace it. The most common problem with NG tubes is that they are not placed correctly. The tube can sometimes coil in the back of the throat, or it may not go into the stomach all the way. If your child begins to vomit, stops breathing, or turns blue during a feeding, you should stop the feeding. Pinch the NG tube closed and take it out right away. If your child is a baby, suction his nose and mouth with a suction bulb. Try to get your child to cry by tapping him. If your child continues to vomit or stops breathing, call 911. Thank you for watching this video. You will be able to successfully care for your child at home by practicing these skills. Your child's nurses are here to help you and answer any of your questions.